Welcome at AICO's webinar. We have selected some of the best presentations from AICO's Europe annual meeting in Florence. We are going to have the really stellar presenters, and I believe we all learn a lot. How to handle a really bad fungal endophthalmitis, presented by Maina Gnanavati from UK.
When you remove the hypopyon, it's quite cheesy, and you have to peel it out of the anterior chamber. 3 weeks later, the patient gets the same thing again. Despite of the treatment, the graft is there. The graft is destined to fail.
In Florence, the latest femtosecond lasers were presented, and Michael Brocken from Switzerland sent them straight into history. Michael Brocken, lenticle addition.
It was great to hear these historical talks about femtosecond lasers. Now let's talk about the future, adding tissue. This is a presbyopia lenticle centered on the center of the pupil. You put the lenticle there and you break up the liquid film, and that's it.
What is the best treatment after the golf ball injury when there is no lens, no iris in the eye? Jorge Alio del Barrio will show us how to connect the IOL with the artificial iris and implant this complex and fix it to the suture. Jorge Alio del Barrio, golf ball injury.
This one is the most tricky moment, because you have to make sure you keep the orientation of the threads and you don't mess up things. Here I'm injecting in the classical mode as many years ago.
Dry eye is on increase and it's becoming global pandemic. It might be a surprise to us that the best treatment might be acupuncture. 4 patients out of 10, absolutely no dry eye symptoms. Worst nightmare patients, isn't that worth thinking about that? Okay, so that was a teaser, and now let's jump right into the first presentation. Maina Gnanavati, nightmare keratitis.